So let's quickly talk about Suggamadex, a couple of high yield points that typically appears on exams and is also important for clinical practice. So the first thing you want to know is that Suggamadex is a modified cyclodextrin. This is a buzzword that appears on exams. Whenever they mention cyclodextrin, just know that that is synonymous to Suggamadex. And then the mechanism of action is that it encapsulates or it binds immunosteroid neuromuscular blocking agents. So immunosteroid blocking agents include things like rocuronium and vecuronium. So Gamadex will only work on these types of medications, but they will not work on things like cisatracurium or atracurium. So Sugammadex will not work on those medications, but will work on rocuronium and vecuronium. Now, the other thing that you want to remember is the difference between neostigmine and Sugammadex for the mechanism of action. Again, Sugammadex encapsulates these neuromuscular blocking agents, but neostigmine actually inhibits acetylcholinesterase. So that's an important note. Again, Sugammadex does not inhibit acetylcholinesterase. Neostigmine is the medication that inhibits acetylcholinesterase. Now, why would you want to use Sugammadex over neostigmine? Well, there's actually a couple of reasons. So, Sugammadex incurs less nausea than neostigmine. That's just one small reason. But the more important one is that Sugammadex is much faster at reversal and is much more reliable at reversing paralysis, especially in deep paralysis where patients have zero or only one twitch. So, Sugammadex is your go-to medication. Neostigmine, on the other hand, won't be effective in situations with deep paralysis. So now, before we continue, let's just talk about a normal action potential, and again, really solidify how Sugammadex works. So in a normal action potential, there's going to be electricity that comes down the presynaptic side, and what happens is calcium enters into this presynaptic neuron, and the calcium then allows acetylcholine to be released into the neuromuscular junction. Acetylcholine then travels down and binds an acetylcholine receptor on the post-junctional side, and this then allows electrical conduction to the muscle or whatever nerve is present. So that's how an action potential is typically generated. Now, the way that rocuronium works is that this medication binds the acetylcholine receptor and it prevents acetylcholine from binding to the receptor, and therefore no action potential is able to be generated on the postsynaptic side. Now, let's take a little bit further. The way that Sugammadex then works is that Sugammadex will see this rocuronium complex and will actually bind it up. It will bind up the rocuronium and preventing it from binding onto the acetylcholine receptor, thereby allowing acetylcholine to bind to that receptor and allow for nerve propagation to occur. So that's how Sugammadex works. And then one last point is, how does neostigmine work? So neostigmine, the way that it works is that it inhibits a enzyme in the neuromuscular junction called acetylcholinesterase. Acetylcholinesterase. And the job of acetylcholinesterase is to cleave or break down acetylcholine. And so if acetylcholinesterase breaks down acetylcholine, there is no acetylcholine in the neuromuscular junction. No acetylcholine in the neuromuscular junction means that nothing is able to bind to the acetylcholine receptor on the postsynaptic side, and so that there is no action potential that is generated. Neostigmine, however, will inhibit acetylcholinesterase, and by inhibiting acetylcholinesterase, there is now more acetylcholine in the junction because this enzyme is unable to break down acetylcholine. And so acetylcholine is free to roam around in the neuromuscular junction, bind to the acetylcholine receptor, and allow for nerve conduction to occur. So this entire diagram is very important to memorize, um, and you will definitely be tested on these medications and the action potentials. So next, for dosing of Sugammadex, this is also very much tested, and dosing of Sugammadex is based on the number of twitches for a patient. So a patient who received maybe a massive dose of rocuronium, or it had an RSI dose and now the surgery is over a little too quickly and may have zero twitches. For this patient, you always want to give 16 milligrams per kilogram. Now, most vials of Suggamadex come with 200 milligrams in a vial. This means that if your patient weighs 100 kilograms, you would essentially need to give 1600 milligrams of Suggamadex. Now, if the patient has mild or moderate paralysis, aka 1 to 2 twitches, you give 4 mg per kg. In this example, if your patient is 400 kilograms, you would give 400 milligrams of Suggamadex. And then lastly, if you have pretty good recovery, 3 to 4 twitches, you only need to give 2 milligrams per kilogram. And again, in this example, if your patient is 100 kilograms, you would only need to give 200 milligrams of Suggamadex. Now, Suggamadex is great, but what are some disadvantages or side effects, things that you need to keep in mind when using Suggamadex? Now, the first two are highly tested, and that is anaphylaxis and bradycardia. And even though these two things are very rare, they do happen, and you need to be ready in case they do happen. So, if a patient gets anaphylaxis soon after getting Suggamadex, obviously the treatment choice is you want to give epinephrine, bronchodilators, things to combat the anaphylactic reaction. And then the bradycardia can sometimes be so severe that patients go asystolic. So there are case reports of that happening. And again, you want to go down the ACLS protocol if you run into ACLS. If the patient just has bradycardia and is very severe bradycardia to the 20s or 30s, things like atropine, um, pacing, that those things can help with the bradycardia. But again, you want to keep these two side effects in mind. Now, there is a theoretical risk of Suggamadex when it's used in patients with severe renal disease. So the way that Suggamadex and rocuronium is excreted is it's excreted renally. So if a patient has impaired renal function, there is a risk that the Suggamadex rocuronium complex simply is not excreted, and there's now time for that complex to disassociate. And if the complex dissociates, ROC is then available to now bind onto the acetylcholine receptor and cause paralysis again. Again, this is just a theoretical risk. So it does not, there hasn't been a lot of clinical research about this happening. But again, just keep this in mind. This is sometimes tested on exams. Next, Suggamadex can interfere with oral contraceptives, so patients should be counseled to take other forms of birth control for at least 7 days post Suggamadex. And then lastly, you may see a prolongation or elevation in your PT-PTT. However, know that there is no clinical effect. It's just the numbers go up, but there is actually no clinical significance for that. But sometimes this is tested. So let's just do a couple of practice questions together just to cement the ideas that we spoke about. So in this question, this is a 70-kilogram patient, has a history of malignant hyperthermia, presents for an emergent appendectomy. The anesthesiologist induced with an RSI dose of rocuronium. Remember, an RSI dose of rocuronium is 1.2 mg per kg. At the end of the procedure, patient has only one twitch. How much Suggamadex should be used to adequately reverse paralysis? So I'll give you a second to think about that. So in this question, we know that the patient weighs 70 kilograms. Um, so for Suggamadex is based on the number of twitches the patient has. So one twitch. Well, let's count backwards. If the patient has 0 twitches, how much would you give? You would give 16 milligrams per kilogram. If the patient had pretty good twitches, 3 to 4 twitches, you would only give 2 milligrams per kilogram. But if the patient only has 1 to 2 twitches, you would then give 4 milligrams per kilogram. So this is the dosage you want to use. Our patient weighs 70 kilograms, so you would just do 70 times 4, and that would give you 280 milligrams of Suggamadex. So the answer is C, 280 milligrams of Suggamadex. Just a couple of other learning points. So this patient has a history of malignant hyperthermia, and the reason why the anesthesiologist decided to use an RSI dose of rocuronium is because they can't use succinylcholine. Now, succinylcholine is not reversed by Suggamadex. Just remember that. Succinylcholine is not reversed by Suggamadex. Suggamadex is only used to reverse things like rocuronium and vecuronium. So let's move on to practice question number 2. So a mechanism of action. This is an ABA basic level type question. So just give you a second to read through these. So choice A is it directly binds to the acetylcholine receptor on the postjunctional membrane. B is it inhibits acetylcholinesterase, thereby increasing acetylcholine concentration. C is it binds aminosteroid neuromuscular blocking agents, preventing them from binding to the acetylcholine receptor. And D is it prevents acetylcholine from being released from the prejunctional membrane. So the answer for this is C. Suggamadex directly binds onto the rocuronium and prevents it from binding to the acetylcholine receptor. Now, the reason why the other answer choices are incorrect, well, directly binds the acetylcholine receptor on the on the postjunctional membrane. No, that's the action of ROCK. ROCK will bind to the acetylcholine receptor on the postjunctional membrane, thereby preventing an action potential and leading to paralysis. Choice B is wrong. It says inhibits acetylcholinesterase. No, that's incorrect. Suggamadex does not inhibit acetylcholinesterase. It's actually neostigmine. Neostigmine is the one that inhibits acetylcholinesterase. And then lastly, D, preventing acetylcholine from being received from the prejunctional membrane. No, there is no medication that prevents acetylcholine from being released from the prejunctional membrane. There are disease states such as Lambert-Eaton or LEMS that will prevent acetylcholine, but again, Suggamadex is not does not act by preventing acetylcholine release. Now, finally, the last question is about a patient with end-stage renal disease presenting for cholecystectomy. The anesthesiologist, upon hearing the patient's diagnosis, determines that which of the following is the best anesthetic plan for emergence. So choice A is regardless of the number of twitches, the patient should be reversed with neostigmine only. B, using both neostigmine and Suggamadex at the time to reverse. C is Suggamadex is absolutely contraindicated in this patient and should be avoided. And D, Suggamadex can be used in this patient, especially if there's a profound neuromuscular blockade. So this might be a little bit of a tricky question because even though there is a theoretical risk about using Suggamadex in patients with severe renal disease, Suggamadex is not contraindicated. Is not contraindicated. So C is incorrect. Um, Choice B is also incorrect. You really shouldn't use both neostigmine and Suggamadex at the same time. What you can do is if you try to reverse with neostigmine, but the patient still has paralysis, then you would use Suggamadex. Or you could just use Suggamadex from the beginning. But there is no case where you would give both neostigmine and Suggamadex at the same time. Now, choice A is also incorrect, saying regardless of the number of twitches, patient will be reversed with neostigmine only. That is incorrect because neostigmine will not work effectively for patients with 0 or 1 or even just 2 twitches. Really, neostigmine is great when the patient has 3 or 4 twitches. In cases where a patient has 0, 1, or 2 twitches, you really want to use Suggamadex. So the correct answer for this practice question, where the patient has end-stage renal disease, is that Suggamadex can be used in this patient, especially if there's a profound neuromuscular block, given you just think about the theoretical risk. However, there hasn't been a lot of clinical data noting that Suggamadex actually unbinds the rocuronium in patients with ESRD. Also, what's important to know is that these patients, these ESRD patients, most likely they will undergo hemodialysis at some point anyways. And so that Suggamadex rocuronium complex will be dialyzed regardless. So that's just another small point to make. And that is everything you need to know about Suggamadex. Thanks.